The following program is a paid presentation for Cigna Healthspring Medicare Advantage.
Medicare. You know what it is, but sometimes understanding all of its moving parts is like putting a puzzle together.
You've never been 65 years old before, so you do not know the questions to ask, much less the answers.
So many choices, and they're just offering all these different things. I just don't know what to do.
There's more choices for insurance, I think, than there is probably anything. I mean, the mailbox would be full every day from one company or another.
The good news is you have plenty of options, so you can find the plan that really suits your needs. But you still have a choice to make. So how do you make the right one? Where can you get the facts? This program is called How Medicare Works. For the next 30 minutes, we'll explore Medicare and the options you have with it. Because regardless of which plan you enroll in, it's important that you fully understand how it all works. You'll hear from actual members. They'll discuss how they chose the plan that best fit their needs and how it helps them get more from Medicare and more from life. So, please join me on my journey as we discover how Medicare works. Let's start at the beginning. What exactly is Medicare? It's health care coverage through a government program that's been around since 1965. And most Americans are eligible for coverage when they turn 65. Some may qualify for disability, which allows them to receive Medicare at a much earlier age. I'm going to ask you to forget everything you know or think you know about health insurance, because under Medicare, everyone's benefits are the same. The choice you have to make is how you want to receive care, how you pay for it, and what extras you want to add. Before looking at options, you should ask yourself, what is important to me? Is preventive care important to you? Do you want a plan that will help you thrive and take care of yourself? How much can you afford to spend on a monthly basis? Do you need a plan that protects you against unexpected costs? Do you want a plan that helps keep you healthy, or just one that's there when you get sick? Answering these questions will give you a sense for what you want and need in a plan. Then you can begin to look at your options. This program will give you a running start to understanding those options. In addition, we've also prepared a booklet just for you called How Medicare Works, and it's a great resource.
Call 1-866-606-7855
to request yours now. Both the call and the information are free, and there is no obligation. If you don't know the basics of Medicare or have questions, don't worry, you're not alone. Before you decide which Medicare option is right for you, there is some basic information you should know. CMS stands for Centers for Medicare and Medicaid Services and oversees both Medicare and Medicaid programs. Part of their job is to protect Medicare beneficiaries and set guidelines for companies involved with Medicare. The other part of their job is to manage the rates and fees associated with your Medicare coverage, which affects the cost to you. CMS also helps give you the information you need to make an informed choice about your Medicare coverage. You can visit www.medicare.gov and find answers to a lot of your questions. Now, let's take a look at how Medicare works. It may surprise you to know that you have been paying for Medicare your entire adult working life. Remember the letters FICA on your paycheck? FICA stands for the Federal Insurance Contributions Act, and it was established by Congress to fund Medicare. The money collected by FICA pays your hospital expenses, except for a deductible, plus 80% of your Part B expenses, which includes doctor's fees, outpatient surgery, and durable medical equipment. Who pays the remaining 20%? You do. And while 20% might not seem like much, 20% of just one surgery could easily be thousands of dollars. For the most part, no one can truly plan for how much 20% could actually be. Coming up, I'll explain the parts of Medicare in more detail, as well as show you what options you have to help cover that unknown 20%. You can also learn about the various parts of Medicare, as well as terms and terminology in the How Medicare Works booklet. Call the number on your screen to request yours now. Both the call and the information are free, and there is no obligation. Let's dive into Medicare and explore its 4 parts, called A, B, C, and D. Medicare Part A covers approved hospital costs, including skilled nursing facilities, home health care, and hospice care. With Part A, you do not pay a monthly plan premium, but do have other costs such as deductibles and copays, which could change each year. Medicare Part B covers most of the things that you would expect health insurance to cover: visits to your doctor, medical services, medical supplies, therapies, emergency services, and more. Medicare Part B does have a monthly premium and also has an annual deductible. And just like Part A, these could change each year. Once the Part B deductible is paid, Medicare will cover 80% of any additional costs. You will have to pay for the remaining 20%. I call this the 80-20 split. This 20% that you're responsible for can be a big question mark. It represents a financial gap for you. One option to make sure you have the money you need to cover this gap is to purchase a Medigap or Medicare supplement plan. A Medigap or Medicare supplement plan is a secondary insurance policy offered by a private company, which can cover some or all of the 20% that Part B doesn't pay. You have to pay a monthly premium for these plans, and the amount varies from company to company. These premiums are based on your age and may be determined by some health issues. Next, we have Medicare Part C, which are Medicare Advantage plans. Medicare Advantage plans are available from private companies who contract with CMS to manage your Medicare benefits all in one. Medicare Advantage plans actually function a little more like the insurance you're probably used to with copays, monthly plan premiums, and doctor networks. One important thing to remember about joining a Medicare Advantage plan is that these premiums are not based on your age or your health. Finally, we have Medicare Part D, and these plans only cover prescription drugs and are sold through private companies. Be aware that plan costs and the list of drugs they cover vary from company to company, and sometimes Part D coverage is included in a Part C Medicare Advantage plan already. Be sure to do your research before choosing a Part D plan. So let's take a look at how Part D coverage works. All Part D prescription drug plans have the same 3 coverage phases, and your coverage changes between them.
In Phase 1, you pay your deductible, if this applies to your plan, as well as your prescription drug copays, while the Part D plan pays the remaining balance until the total drug cost equals the Phase 1 limit.
Once you and your Part D plan have reached this limit, you will enter Phase 2.
Phase 2 is commonly referred to as the donut hole, or the coverage gap. During this phase, many brand name and generic prescription drugs are discounted, some as much as 50% or more. And for some plans, you may pay the same copay as during Phase 1. Once the drug costs you have paid during Phase 1 plus Phase 2 equal the Phase 2 limit, you enter Phase 3. Phase 3 is referred to as catastrophic coverage. During this phase, you pay a 5% coinsurance or your Part D plan's assigned copay, whichever is greater.
For more information on Part D and the donut hole, call the number on the screen. You can also request the booklet, How Medicare Works. The call and the information are free, and there is no obligation. At this point, we've learned what CMS is, who's eligible for Medicare, and about the 4 parts of Medicare. If you haven't already enrolled in Original Medicare, you must do this before you can choose any other Original Medicare options. Contact Social Security 3 months before you turn 65 to enroll, or you can enroll online at www.socialsecurity.gov. Once you enroll in Medicare Parts A and B, you can now consider your Original Medicare options to help cover that 20% gap we talked about earlier. And just like the insurance you're used to, there are certain enrollment periods based on your situation. The initial enrollment period is for those new to Medicare. You have a 7-month window in which to enroll in Original Medicare and then also choose your Medicare options. This enrollment period includes 3 months before your 65th birthday. The month of your 65th birthday and 3 months after your 65th birthday. After your initial enrollment, you will have an annual enrollment period each year to make changes to your plan if needed. This period is from October 15th to December 7th. And during this time, anyone eligible for Original Medicare can enroll in, disenroll from, or change their original Medicare Advantage or Part D prescription drug plan. After this annual enrollment period ends, there is the disenrollment period, which begins on January 1st and runs through February 14th. And during this time, if you are enrolled in a Medicare Advantage plan but are unsatisfied for any reason, you can disenroll and return to Original Medicare only. If you decide to return to Original Medicare, you can still purchase a separate Part D prescription drug plan from a private company. Once the annual enrollment and disenrollment periods end, you will have to keep the plan you choose for the remainder of the year, unless you qualify for a special enrollment period. A special enrollment period allows you to make changes to your plan year-round. How do you qualify for a special enrollment period? Well, there are a variety of situations. Do you have Medicaid? Do you have a low-income subsidy for prescription drugs? Have you lost coverage through an employer? Did you recently move in or out of a planned service area? To see if you qualify and to get more information, call 1-866-606-7855. You can also request the How Medicare Works booklet. The call and the information are free, and there is no obligation.
So, now that we've covered the basics of Medicare and the options that are available, let's take a closer look at how Medicare Advantage plans work. We'll also talk to a number of Cigna Healthspring members to get their perspective on the benefits of a Medicare Advantage plan.
A Medicare Advantage plan can make your health care coverage feel more like the health care coverage you've always had. As I've shown you previously, Part B of Original Medicare covers 80% of approved charges. The other 20% is paid by you. But with Medicare Advantage, 100% of your Medicare benefits are covered by the plan. You can count on low or even $0 monthly plan premiums, low copays, low deductibles, and more. Medicare Advantage plans may also have extra benefits, like prescription drug coverage, dental coverage, gym memberships, and even an eyewear allowance, just to name a few. So, does this mean a Medicare Advantage plan may be right for you? That's a decision you'll have to make based on your needs. But I can tell you that with Medicare Advantage plans, you'll still have all of your original Medicare benefits, plus more. And you'll receive the same rights and protections as Original Medicare. You'll have more value with lower out-of-pocket costs. All of this in a plan that feels more like the insurance you're used to. But don't just take my word for it. Call the number on your screen. You can also request the booklet, How Medicare Works. Both the call and the information are free, and there is no obligation. To get an even deeper understanding of Medicare Advantage, let's take a look at Cigna Healthspring. Most of us are familiar with Cigna as a health insurance plan. In fact, millions of Americans have relied on Cigna for their health care coverage for over 100 years. Cigna also has a Medicare Advantage plan with an 87% satisfaction rate and a strong record of keeping members happy. Sound too good to be true? Listen to what actual Cigna Healthspring members have to say.
Okay. All right.
Randy, how you doing?
Good. Glad to see you.
Good to see you too. Is Cigna Healthspring easy to use?
Well, I'm much more happy with Cigna Healthspring now compared to the insurance that I had previously. And my main concern is that who would I have to turn to if I became ill? And it's a comfort that I have Cigna Healthspring and their team that I can turn to.
You have one card to carry.
You got one card that you carry to take care of it that gives me phone numbers if I need to call, if I have issues or problems, and that's simple enough.
Randy, does your primary care doctor help you find specialists?
My primary care doctor does help me find specialists, that's another plus for Cigna Healthspring. Because if I need a specialist or something special comes up, he's the one I can go to. He's one that can make the contact, and I have confidence in that.
So do you feel included in a team? Team atmosphere
Cigna
with
Healthspring? I couldn't feel any other way, it being a team spirit.
I saw on television an advertisement for taking a vaccination for shingles. And so I thought, Lordy mercy, I've not had that. I've had TB, I've had this, I've had hepatitis. So I was going to sign up to get one. But then I thought, well, I better call my doctor. Well, I called my cardiologist, and he said, oh, no, don't take anything until you call your primary care doctor. Well, when I did that, I thought they were going to have a heart attack. Oh, no, son, all the medicine you're taking, you cannot take that vaccination. But each one was making sure that I got the proper care.
Is Cigna Healthspring affordable for you? And how does it help you save money?
Well, for one thing, I don't have to pay any premium.
Oh, that's nice.
My co-pays are low, and when I go see a specialist, it's a reasonable cost.
The biggest thing to me are the premiums. Much more affordable.
And Cigna Healthspring paid the bills.
All your prescriptions are one low price.
Do you know what your monthly premium is?
Oh, as far as my premiums towards my health care, they're zero.
Zero.
Isn't that amazing?
Cigna Healthspring, there's zero. You can't beat that.
Cigna Healthspring, what's the one thing that really stands out in your mind?
The one thing that stands out in my mind about Cigna Healthspring is the service that they provide. I don't have to worry about it if I have to go to the doctor or to the hospital because they handle all the details. Cigna Healthspring takes care of so much, I don't have to worry about Part A, Part B, etc., because they take care of all that.
I value my friends, I value my family, I value my free time. I'm retired and I'm enjoying my retirement. I feel comfortable knowing my health is taken care of. And that's a big worry once you get to my age.
For more information, call 1-866-606-7855. You can also request the booklet, How Medicare Works. Both the call and the information are free, and there is no obligation. The centerpiece of the Cigna Healthspring member experience is their team approach to your care. It keeps all of your doctors connected and talking. It positions you and your primary doctor as the leaders of your healthcare, allowing you to work together in a way that other plans don't. It also provides your primary doctor with a full picture of your health to better understand your health needs and get you the right care. This team approach can have a real impact on your life and health.
Dr. Chambers, how are you?
Fine, how are you?
Doing great. Describe how you work with other physicians to create a healthcare team for your patients.
You know, the healthcare system in America is in a lot of ways broken. The average clinic visit in America is about 6 minutes.
Yeah.
And I think what we're trying to do is bring it back to the center, and that's really the primary care doctor working with their patient one-on-one as the quarterback of their entire healthcare. And we really pride ourselves on working with physicians to build that team, not only for the patient and the doctor, but the Healthspring team as well.
What makes the doctor-patient relationship different than with other health plans?
Cigna Healthspring is really an area we've excelled in, and I think a lot of other insurance plans are doing a lot of good things, but I think by empowering the primary care physician to better care for their patient, it really sets Cigna Healthspring apart from its competition. And one of my roles as the Senior Medical Director for Healthspring is really to work with physicians to help them provide better care for their patients, our members. We do it in a lot of different venues and a lot of different ways, but I think that's something that sets Cigna Healthspring apart from some of the others in the industry.
Does your primary care doctor and specialists talk to each other?
It's everything that I need to know. I can just go to my primary care doctor, and it seems to flow from there as to what care I need and how that needs to be taken care of. Prior to that, you had to do your own shopping around. You had to worry about what specialist you were going to. With Cigna Healthspring, I don't have to worry about that.
A pretty amazing story here, a life-changing story for you. The underlying theme of Cigna Healthspring, it's a big team that's working for you, and they take everything away in terms of guesswork, and you can enjoy your lives and do everything you need to do, and they will take care of the heavy lifting, right?
One of the first calls I received was from my case manager, and Cigna Healthspring had assigned a case manager just for me, for my transplant.
Right.
And she calls every 3 weeks, wants to know how I'm doing. And she told me all I need to do is to get well. Don't worry about the hospital bills. Don't worry about anything. And it's true. I haven't had to worry about not one single thing. Cigna Healthspring was right on top of everything. They correlated all my doctors. Mm-hmm. Each one of them had to email or fax the other one. So when I go to one doctor, anything that my primary care doctor had prescribed for me, they already knew about it. They had it on the paperwork right on top.
And they recognized me as being part of the heart transplant too, and they were calling me to help me get through it. I couldn't imagine that.
Everyone's in touch with everyone in this situation and making sure that all of you are fine.
Absolutely.
Very true.
There's someone I'd like you to meet. Stephanie Atkins.
Oh, Stephanie.
Hi.
Oh, precious.
It's so good to see you.
You're not just the voice on the phone.
No, I'm not.
Okay, this is my wife, Mamie.
Stephanie.
Mamie.
Oh, thank
Hi.
you.
You're welcome. You're welcome.
Your approach to member care is really incredibly passionate.
It's like for your own family. What you would do for your own family.
She did make us feel like she was part of our family.
I thank you so much.
You're welcome. It was my pleasure. You have been wonderful to work with. You have been a blessing to me too.
I take my medicine.
Good.
Every day.
Every day.
Cigna Healthspring also does a lot to keep members healthy behind the scenes. They give their doctors the tools and information they need to improve care and to deliver preventive care more efficiently. And they make sure doctors have more time to spend with their patients. So the focus is on doing everything they can to get you healthy and to keep you healthy.
Do you and your primary doctor have a plan to keep you healthy?
Cigna Healthspring itself has a plan. They periodically send you out periodicals or articles pertaining to what to look for, what expectations you should get out of your primary care doctor even, what symptoms, if you suffer certain symptoms such as from diabetes, such as high blood pressure, they're constantly keeping you alert as to what conditions you should be looking for at a person's age.
Do they give you like lifestyle advice also? Maybe you're eating this, and you know, more vegetables, more this, so they integrate that with everything else that they're doing for you?
Well, since I've been with Cigna Healthspring, they have continually reassured me that they are concerned about my health and my future, because they're constantly, again, reminding me of the kind of foods I should be eating, could be eating, and again, how these things affect your body and how much better they are for you as compared to other things that are not so good for you.
Compared to when we were 20 and, you know, eating hot dogs and fries all the time.
Exactly. All the good old days.
Yeah.
Yeah.
One thing these members keep mentioning is the emphasis on preventive care. To help you understand why Cigna Healthspring's focus on preventive care is so important, look at what it really means for members.
What you will see is about 50% of the time, the preventive measures like breast cancer screening, colorectal screening, that those things are being done about 50% of the time. Now, it's not that they're bad doctors.
Right.
It's often about process.
Yeah.
And that's where we step into the arena and we provide that process.
Right.
And what you see is these numbers go up 70%, 80%, and in one case in Tennessee, we even have numbers in the 90% range. So if you are a woman, and breast cancer affects 1 in 8 women in this country, which it does. And we've improved the breast cancer screening rates from 50% to 84 or 85%. What that means to me as a physician is that some woman, almost without question, got their breast cancer detected early.
That's another good thing about Cigna Healthspring. They will send you notices to remind you that this is due or how often they should be done in the event that you haven't had them done yet.
And Cigna Healthspring, they want to keep you healthy, so they offer you these tests before there's a problem, and I like that.
By making sure you get the screenings, vaccines, and procedures needed to keep you healthy, your risk of serious illness may be lowered. It all comes back to what's important to you. If you want to stay healthy and get the most out of your Medicare and your life, Cigna Healthspring may be the answer. Call the number on your screen and request the booklet, How Medicare Works, for more information. Both the call and the information are free, and there is no obligation. I want to thank you for watching. I hope you have a better understanding of the basics of Medicare and the options you have. I also hope that hearing from actual Cigna Healthspring members was valuable. Cigna Healthspring takes a unique approach by partnering with doctors and giving them resources to deliver the best care. It's quality care that helps members live life to the fullest.
With Cigna Healthspring, what's the one thing that really stands out in your mind?
It feels like family. When I go to see the doctor or to the hospital or to Silver Sneakers, it's all family. You're just comfortable and at ease.
Cigna Healthspring is a good outfit. If you don't have it, I'd recommend it.
If you want to have good health, if you're looking forward to the future, come to Cigna Healthspring.
We've covered a lot of information, so don't forget to call and get the How Medicare Works booklet today. It talks about the things you need to know about Medicare, including Cigna Healthspring's team approach and how it can all work for you. Get more out of Medicare and more out of life with Cigna Healthspring. Call 1-866-606-7855 and get the booklet How Medicare Works today. It can make a big difference for you or someone you love. Thank you for your time, and thank you to all of the Cigna Healthspring members who spent time talking with me. The preceding program was a paid presentation for Cigna Healthspring Medicare Advantage.